Pediatricians are saying their offices are overwhelmed with sick kids, with a lot of patients having respiratory symptoms.
Western Mass News reporter Paris Dunford talking with doctors about how the pandemic and flu season is going to put a strain on the healthcare system.
October usually brings cooler temperatures and fall foliage, but this year it also marks the start of what looks like a very busy respiratory virus season.
It's a whole different animal for us this year.
Dr. John Kelly is a pediatrician at Redwood Pediatrics. He says his office is busier than ever with sick children, with cases of RSV, COVID-19, and even the flu. This is always a busy time of year for doctors' offices, as it's the start of respiratory virus season. But add a pandemic in the mix, and it's a whole different ballgame.
Now we're dealing with a respiratory illness that's 6 times more deadly than influenza, or roughly 6 times more deadly, and that's a big deal. That's still a pandemic, and that changes the ground rules.
Dr. Kelly tells Western Mass News he can't see as many sick patients in a day as he could in previous years. That's because they have to take extra precautions because of COVID-19, and those measures take up time.
I used to be able to see 4 to 5 those children in an hour, and now it's down to 2 to 3.
And that's really the concern for all healthcare offices this flu season.
It will strain the whole system as well, not necessarily because of COVID-19, but just because of these other respiratory viruses.
Dr. Armando Paez is a chief infectious disease doctor at Bay State Medical Center. He predicts this flu season will be very busy, and that is going to put a strain in already overwhelmed hospitals. And respiratory viruses all have similar symptoms, such as a cough, body aches, a fever. So people with symptoms are going to get tested for COVID-19 to reduce the spread.
If there's a spread of this infection in the community, a lot of people will be calling their doctors.
Reporting for Western Mass News, I'm Paris Dunford.